The consensus framework for the past into the future was set 25 years ago, and if we reflect now where we are, I think clearly we see progress. Now, whether that's even, whether it's equal, whether it's fast enough, whether it's progressive enough, is questionable. But by and large, women are able to have their rights and choices to access sexual and reproductive health. But for us, one maternal death is just simply unacceptable, especially when they're preventable. But I think there are 4 areas that I wanted us to think about. The first is elevate. The second is enable. The third is expand. And the fourth is expect. Elevate is really, how do we elevate midwifery care to be integral to sexual and reproductive health services? We really must have every single voice that amplifies the importance and the centrality of midwifery care. Because we know when we train and enable midwives at international standards, we are able to actually meet 87% of the needs when it comes to sexual, reproductive, maternal, newborn, and adolescent health. Enable. What would it take to enable us to do what we need to do better? Expanding. And there to us is back to this notion that a midwife is not only just delivering, but she's the most fundamental health cadre, we think, a nurse midwife or a midwife at the primary health care level. And therefore we are asking of her, and she can, deliver on an integrated package. In terms of expect, we spent some really good time this year thinking, future-proofing, what is the world going to look like? And how can we, at this stage, start planning for that? Our mission is that every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. And we have committed to ending preventable maternal deaths, unmet need for family planning, gender-based violence, and HIV by 2030. And we know that we cannot do that without the midwives central to that agenda.